The water-soluble vitamins include vitamin C and all of the various B vitamins, which we'll go into more detail about in the coming segments. So water-soluble vitamins dissolve in water. This means that food preparation and our cooking methods can actually cause nutrient loss. So think about when you boil broccoli. What color does your water look after you've boiled? The water is green. So this is basically indicating that all those nutrients in your broccoli are being leached or lost in that water. So this is why we usually recommend things like steaming because it can prevent nutrient losses. There's a good table in your textbook that talks about ways to minimize nutrient loss as well. But just be mindful of the fact that water-soluble vitamins are going to be lost because they do dissolve in water. They are easily absorbed in the body, and then they're excreted through the urine. So there's really no storage tissues for them in the body. So unlike fat-soluble vitamins that don't have to be consumed every single day, water-soluble vitamins need to be consumed pretty frequently because we have no storage and they are excreted from the body. Because they are excreted so readily, we rarely see toxicity of any water-soluble vitamins. That's not to say that there's never any toxicity, but it is very uncommon. And foods are never going to deliver toxic doses because of these reasons, that excretion and then the lack of storage. But supplements can cause toxicity, and we'll talk about this as we go through the section. So our first vitamin, water-soluble vitamin, is vitamin C. Vitamin C acts as a cofactor for enzymes, which means that it's going to assist enzymes involved in formation and maintenance of collagen, which forms the basis for all of our body's connective tissues and skin and scar formation. Like vitamin E, vitamin C is also an antioxidant. Specifically, it helps to protect iron in the intestines from oxidation. So again, it's helping to scavenge some of those free radicals in the body to prevent cellular damage and oxidation inflammation. And vitamin C is also has a special role in helping to enhance iron absorption. And we'll talk more about that next week when we talk about minerals and specifically iron. Also, as an antioxidant, it helps to preserve and recycle vitamin E. So vitamin E and vitamin C really work together as sort of friendly antioxidants. You've probably heard that vitamin C can help cure the common cold. So while vitamin C probably does have some immunity properties, there's really no strong scientific evidence to say that it can cure the common cold. And most of the time it may be this placebo effect when we consume these high doses. So you can check that little myth out in your textbook as well. Vitamin C deficiency is called scurvy, and the symptoms are related to collagen breakdown. So remember that vitamin C is involved in collagen production and then collagen maintenance. So scurvy is basically the breakdown of that. Scurvy is going to be characterized by a loss of appetite, growth cessation, having tenderness to touch, bleeding gums, swollen ankles and wrists, anemia, red spots on skin, weakness, and then loose teeth. So those loose teeth and bleeding gums really go together, and there is a picture of that in your textbook. So you may have heard about the story about soldiers on a ship, and all they had to eat was citrus, and when they started eating that, they basically reversed the signs of scurvy. So vitamin C deficiency is pretty rare in today's world. However, infants that are fed with cow's milk that don't receive any vitamin C supplementation, elderly individuals, people that are pretty ill or severely sick, and then alcohol and drug abusers may experience vitamin D deficiency, but in today's world, it's fairly uncommon. Vitamin C from food is always safe. You're never going to have vitamin C toxicity from consuming too many oranges or too many grapefruit or too many whatever vitamin C source you're consuming. But supplements is again where we need to be concerned. If you take more than 2 grams of vitamin C per day, this can alter insulin response, it can interfere with blood clotting medications, it can increase the risk of kidney stones, and it can also cause gout. So none of those are very good symptoms or side effects to have. Excess intake can also be dangerous for people that consume too much iron. And then doses of more than 10 grams per day are unsafe and not recommended at all. So don't consume vitamin C in supplement form. It's probably not worth it. It's not going to be necessary. The recommendations for vitamin C are 90 milligrams per day for men and 75 milligrams a day for women. And just like with vitamin E, where smokers had higher needs, smokers also have increased needs of vitamin C, again due to that oxidation that's going on. So for smokers, the need for vitamin C increases to 125 milligrams per day for men and 110 milligrams per day for women. Individuals that are undergoing or experiencing physical stressors also have increased vitamin C needs. And vitamin C is found in fruits and vegetables. Usually we automatically think of citrus foods, but strawberries actually contain more vitamin C per serving than an orange. So many fruits and vegetables are going to be a good source of vitamin C. Vitamin C we want to be careful with handling just because heat and oxygen can destroy vitamin C. So again, just being mindful of preparation and storage to maintain the function of vitamin C so you get the most out of all of your foods. Alright, so the B vitamins. These also function as coenzymes, so what they do is they combine with enzymes to actually activate that enzyme. And they're very specific, so the coenzyme shape matters. So they're not going to just match with any enzyme. They each have a specific enzyme. So they're very specific. B vitamins also play a role in metabolism. You may have heard of them referred to as the energy vitamins, which they are energy vitamins, but they do not provide energy for the body. So don't get confused there. The only nutrients that provide energy for the body are carbohydrates, fat, and protein. What B vitamins do is they help the body to use the energy from carbohydrates, fat, and protein. So they are our energy vitamins because they help us get that energy. They're also involved in protein synthesis and cell multiplication. B vitamin deficiencies are of concern because every cell is going to be affected in the body if there is a deficiency because of that energy component with them. So some symptoms of vitamin B deficiencies include nausea, severe exhaustion, again because we're not able to get that energy out, we're going to be exhausted, irritability, depression, forgetfulness, loss of appetite, and weight loss. Can also cause impaired immune response, abnormal heart action, skin problems, swollen red tongue, teary or red, bloodshot eyes, and muscle pain. B vitamin deficiencies are rarely isolated, so B vitamins are in pretty much every food. So if a diet or an individual has a vitamin B deficiency, one of the vitamin B deficiencies, they probably have a deficiency of some other nutrient as well. So it's usually not an isolated incident. And we'll talk about the specific deficiencies for each of the B vitamins in our next segment. So as a little preview for our next segment, where we're going to talk about each of the B vitamins. This is a silly little sentence, but it can help you to remember all of the B vitamins. So Tinder romance never fails with 6 or 12 beautiful pearls. So thiamine, riboflavin, niacin, folate, vitamin B6, vitamin B12, biotin, and pantothenic acid are going to be our B vitamins that we're discussing. So use this sentence to help you remember each of those. And it's a fun little tool, mnemonic to help you remember those. So we'll talk about each of these in the next segment.